I don't mind carrying the extra weight. I think of it as my daily exercise.
BestMed Medical Scheme. Better living, better life.
The 4 leading activities responsible for concussion in children are cycling, rugby, playground activities, and soccer. Should we ban those activities? No, of course not. I have a son who plays all 4, and it's impossible to prevent kids from ever being injured. So we do what we can to minimize head blows. Always wear appropriate headgear. And by that, I mean helmets, even when you're just riding in the driveway. Seatbelts, chest and waist straps. Remember, a child's head is heavier in proportion to the rest of his body and always leads headfirst in a sudden stop. And then take it easy after a concussion. A repeat concussion, which we also know as second impact syndrome, is more dangerous and could result in permanent brain damage. Try as we may, though, they're going to bump their heads eventually. Fortunately, most childhood falls or blows to the head result in injury to the scalp only, which is usually more frightening than threatening. So what should we do when it happens? Well, the goose egg or swelling that may appear after a head blow is the result of scalp's veins leaking fluid or blood into and under the scalp. It may take days or even a week to disappear. Apply an ice pack or instant cold pack to the injured area. If you use ice, remember to always wrap it in a washcloth or a sock even. Ice applied directly to the bare skin can cause a cold injury to the skin. If the incident has occurred close to bedtime or nap time and your child falls asleep soon afterwards, check in once or twice. There's no need to keep a child awake after a head injury. And then observe your child carefully for the next 24 hours. If you notice any of the signs of internal injury, call your doctor immediately. So what are those signs? Well, call your doctor if your child is an infant, has lost consciousness even momentarily, or if a child of any age has any of these symptoms. Unconsciousness for more than a few minutes, abnormal breathing, bleeding or clear fluid coming from the nose, ear or mouth, weakness or paralysis, pupils of unequal size, a child that vomits repeatedly and that's difficult to awaken. And remember, the golden rule is this: if in doubt, always check it out. That's what we're here for.
Working from the world-renowned Pediatric Neurology Unit at Red Cross Children's Hospital, Professor Anthony Figaji is using cutting-edge techniques to drastically reduce the amount of children who end up disabled or die as a result of serious head injuries.
Trauma, unfortunately, in South Africa, in particular head trauma, is often considered the forgotten or silent epidemic, not recognizing that it's almost as big a cause of premature mortality as the HIV/AIDS epidemic, but receives less attention in terms of funded research and programs to develop protocols not only for prevention but better treatment. Concussion is a form of head trauma where the electrical circuitry of the brain is disturbed, and that may be temporary or permanent, but it's on the milder end of the spectrum of head trauma, and the whole range all the way through to the more severe end of head trauma where patients come in comatose and require ventilation. Most of the severe injuries that we see in children certainly are related to road traffic accidents, and your chances of a child dying due to head trauma is about almost 7 times higher than a similarly aged child in the United States.
SA's culture of drunk driving, packed minibus taxis, and our lack of vigilance around seatbelts is largely to blame. Many facilities also aren't equipped with the tools required to prevent permanent damage.
When one's operating on the brain or the spinal cord of a child, or in fact an adult, the risks are always high, higher than most other surgical disciplines. The problem is particularly in certain areas of the brain or spinal cord where there's a close relationship to what we call eloquent function, and those are nerves that have very important functions in terms of the functioning of the body. Any disturbance of that function can potentially lead to permanent paralysis or even quadriplegia. Pediatric neurosurgery in particular is a rare privilege. We have a profession where we're stimulated and challenged. We often stretch to our limits, but we're in an area that is incredibly fascinating. The brain is fascinating. And then in particular, we have the opportunity of making a difference in individuals' lives. And when those involve children, there's a special privilege and an honor to be part of that. You can't always save them. And people often ask us, does that take an exacting toll on us? It does, but it's more than counterbalanced by the lives of the children that we can save.
Preventing head injuries is the first prize, so we should all teach our children to buckle up, wear a helmet, and be vigilant from an early age. It could save their lives.